Namaskar, ma'am. A warm welcome to our IGY.
Namaste, Shivani. Thank you for inviting me.
And we express our immense gratitude for joining us uh, for this cancer care program, for being part of this program, for being part of this digital initiative. We are so grateful to you.
Thank you, Shivani. Thank you for the opportunity.
Let's start, ma'am. Let's start with your experience. Ma'am, tell us about your journey as a yoga therapist while healing, while staying in touch with the people who are affected with cancer. What lessons that has taught you as a yoga therapist? What were your experiences?
Almost 30 years ago, my father died of cancer. And in those days, when you heard the word cancer as a diagnosis, it's almost like a death sentence. We don't know much about the nature of the cancer or what stage it is, what type of cancer. But the moment you hear the word cancer, it feels like somebody is being given a death sentence. And that's how I felt when my father was diagnosed. And he died within 6 months of heart attack, not because of the cancer. But uh, from then on, I think that was my closest encounter with the cancer and, looking at the whole process and what it does to the person, to the family, to the people around, all of that. Um, so it's still a kind of a dark cloud looming large above you when that word is pronounced. Some people don't even want to use the word cancer. Today we have moved a great deal in terms of medical advancement and integrated therapies, complementary therapies, all of that, as well as seeing that cancer becomes so common. It's become so common, right? And we don't need to look at it in a particular way. So we need to all, I think for me, it was about really reconfiguring my idea of what that meant and how to look at somebody with cancer. Right? One of my students said very beautifully, it's not every time you meet somebody, it's not that you're meeting a dying person, you're meeting a living person, right? That's very important that you meet a
Absolutely.
living person and not a dying person, even if they are end stage cancer, even if we don't know how long they will survive, whether you will see them tomorrow or not. That's one thing. But for me, it was not about cancer actually, because in our tradition, in the Krishnamacharya tradition that I'm trained in, it is the person who's important, and we meet the person, work with the person who may have the condition. So I have some long-term students who've been coming to me for 20 years, 15 years, who develop cancer, some form of cancer at some point, and then we work with it, and then they have recovered, and then we continue with some of the other issues. So it's not even like a big problem in that sense. But then sometimes people do come with end stage cancer, and treatment possibilities are not there for whatever reason. Then we'll have to still see what we can do. So for me, it is always about remembering to meet the person where they are, rather than keep this, the idea or the screen cancer in front of me through which I see the person. I don't want to see the person like that. And everyone, or any form of cancer, has its own peculiar ways in which it presents itself. And the individual is more important. Sometimes I've seen people take it so well. They're able to move into that stage of acceptance very quickly. It doesn't take a very long time for them. And in that sense, it's easier to work with them. And sometimes people are in the stages of denial and anger and, depression, bargaining. It will be like all the treatments have, stopped, and had people asking, do you think spontaneous remission is possible at this stage? Do you think I can completely cure myself with yoga and all of that? Truly, I don't know. I can only say I don't know. I don't want to bring my fears and doubts. At the same time, I don't want to promise them anything because I really don't know. So all that we can say is, yes, we will work and we will do what we can, right? today you are well, you are alive. Let's work with this. Let's work with the breath. And Krishnamacharya beautifully said, if you can breathe, you can do yoga. So as long as somebody can breathe consciously, and at some point, even breathing becomes difficult, right?
Absolutely.
So we have to see what we can do. For me, the experience is I am learning with each student who comes to me. And in a sense, then they are my teachers. And I have to be open to learning so that I can know what is that I can offer to them to ease their pain, reduce their anxiety, make them sleep better, maybe improve their energy levels, make them look at life as, you know, much more than this problem and see themselves much stronger than the problem. Yeah, that is the direction.
That is so beautiful. That how, in a nutshell, with your own experience, you have explained uh, that how with each patient who's walking in, or I'll not say patient. Let's forget this word. Each individual who's walking in your studio, your center, that changes your outlook towards being compassion or healing. They change the definition of
Correct.
it.
Yeah.
So yes, Saraswati ji, this is a beautiful. I think with the first answer, there's a huge takeaway for all the people who are attending this IG live. But let's go back to the basic. What is the difference between any class which is created for a cancer patient, specialized yoga session for a cancer patient, or any regular yoga fitness class? What is the difference?
So in a regular, I wouldn't call it a fitness class, maybe we'll call it a yogasana class or something.
Yes.
People come with reasonably normal state of health, right? Their energy is not compromised. They don't have any specific health issues that might demand some kind of modification or whatever. So we are going to just teach them a regular practice and observe them and modify, adapt the practice to them. But when a person comes with a health issue, cancer being one of that, you need to understand the person. It's not about offering some practice to them, but understanding the person and seeing what is the practice that I need to offer. What are their needs, right? And understanding the causes of the problem, understanding the person. Some people have very high level of anxiety. Some people are still battling with a lot of anger and resentment. Some people are moving into acceptance, but still in a very confused state. And physically, like not having enough energy, foggy mind. If they're going through treatments and the after effects of the treatment, all of that is happening. So I just have to meet them that day where they are and see what we can offer. So it is very different from doing a general yoga class. It's all person centric, completely person centric.
Absolutely. But here, Saraswati ji, let me put this question in a different way. While I was building this program, I did a lot of research on medical papers available and journals available, and all of that says that yoga and pranayam helps in reducing the stress, reducing the inflammation. But with your experience, I want to understand that is there really any meaningful changes which you have observed or witnessed in your patients? Or sorry, in your individuals who are working in your studio?
Absolutely. I think anybody who practices regularly, it's not just somebody who comes to a class, takes a practice and goes away. We teach one on one. So if they're practicing regularly, definitely we see a lot of difference in reduction pain levels, improved energy levels, better sleep. The mind is calmer. So they're able to think better. They're able to, self regulate better, even to look at the food that they're eating, having some level of exercise, all of that. So all of those changes happen, particularly when we use the breathing, whether it is an asana where we are bringing conscious breathing or pranayama, the focus on exhalation, right? Exhale has a very deep calming effect on the mind, also has a detoxifying effect on the body, on the physiology. And exhalation helps to arouse the parasympathetic nervous system, right? So the sympathetic activation is very strong. There's so much fear, there's a great sense of vigilance. every little symptoms, particularly person has completed the treatment, anything might trigger this memory and say, oh, is it coming back again? The fear stays on for a long time. And the fear of not just death, but fear of pain, fear of becoming dependent, fear of not being able to do what one loves to do, all of that. So when they start doing the practice, the system calms down, the mind calms down. There are lesser number of thoughts, say, that interfering with the healing process. And then the body, with its own intelligence, will start working better. And so you're not interfering with the body's intelligence of healing. All that we have to do as therapists is enable them to get their mind and themselves out of the way.
Yes,
Yeah.
absolutely.
And that is the only thing we need to do. But we also have to remember that we, in our interaction with them, we are also deeply involved in the process. So our own fears, our own doubts, our own misgivings, our own memory from the past, other patients can get projected onto that person. So I have to really be sure that I'm pulling away all those layers and meeting that person afresh. So I have to meet myself afresh every moment. Right. So definitely there is no question. It helps in a huge way. Somebody is able to sleep better. They're more relaxed. They're more positive. They have more positive thoughts in the mind. They're not going into that negative loop again and again. And this is something that we hear every time when somebody is doing a regular practice.
Yes, yes. So, Saraswati ji, you have given the toolkit for a yoga therapist to teach to that individual. But what about a toolkit for a yoga therapist for himself or herself? You said that there are moments that you can be also get carried away and you have to make sure that you don't get absorbed in that part. So, how do you keep yourself fresh throughout?
See, there are three or four things that I would look at as most important. One is our own practice. That I have a regular practice of asana, pranayama, meditation, chanting, whatever that might be, that actually helps me to go closer to myself, become more self aware, to be able to observe better, listen better, and to understand what is happening to that person. And that can only happen if I'm able to be aware, self aware, right? So, practice is essential. Practice will also help me to understand the tools and how to apply them better. I have to explore constantly, which means I have to study. I have to understand, go deeper, back to my teachers, back to the study of how these things are working. Maybe it is textual study, maybe it is working with the teacher long term. Maybe it's also understanding the medical terminologies, but I don't need to get into that too much. The doctors know that. I don't need to know everything that they need to know.
Yes.
But to some extent, I need to have some understanding of how the cancer and the treatment impacts the individual. I can't be dismissive of some symptoms because I've not seen it in another person with cancer, because it's so varied, the kind of medication they use and everything is very different. So I can't superimpose a memory of something else somewhere else onto this person. Yeah. So some knowledge is also essential. And the knowledge that I don't know is also very important.
Yes,
Yeah.
accepting that.
Yeah. Going back to a teacher, supervision, I think is extremely important. So in say psychotherapy or people who work as psychologists, they do have a supervisor that they go back to talk about what's happening. We all need, because we are meeting people with great pain,
Right.
and sometimes that you carry that pain with you. It impacts you. I used to get very depressed many years ago when I was working with people with depression and trauma and all that. It was very difficult for me to come out of it because it was impacting me a lot. So practice had to get stronger. Going back to a teacher, talking about it, and really clearing out, that is important. And then a community. I think both building a community for the students who are struggling with these problems and being part of a community, where there are teachers, psychologists, doctors, to have these conversations and to really, to some extent, learn how to demystify this. We
Absolutely.
have to learn to normalize many things. If
Yes,
it's
yes.
possible for somebody to have a chemotherapy and then go back to work on the same day or the next day, we don't need to make it into a big thing. But we have to accept that for that person, what they're going through is that gravity of that situation has to be accepted. At the same time, not project something onto what is there.
Right.
Yeah. So I
So
think these are important.
I absolutely agree with you that there is a lot of work on our emotional and psychological balance is also required.
Yeah.
Um, but here I have a question with you because I have seen in a lot of Western countries that doctors work in a team. There is a yoga therapist, there is a psychologist, there's an oncologist, there is a physiotherapist, and there is a caregiver also. They work together in a team to heal cancer patients. So do you think that we also in our system require that thing, and how it will make a difference?
What do you think, Shivani?
I have an answer, but I want to hear it from you.
Absolutely, absolutely. I think this should be considered the gold standards of any form of treatment or healing process. That everyone has to work together. No one system has all the answers. Yeah, we have to understand that every system has great strengths, also some limitations. So if you're going to an oncologist, they can take care of your physical, physiological issues, but they can't be sitting and counseling. Some of them are good at it. They're very compassionate as human beings, and you really like and want to go to such people. But not everyone. They may be very good at their work, but they may not really have the skill
Yes.
that's required of a counselor. I work with homeopath, with an Ayurvedic physician. We have some medical doctors who refer their patients to us. So we have conversations. I'll go back to my Ayurvedic physician and say, you referred this patient to me. Can we talk about this? And what would be your perspective? How would you like me to work? And he may give me, with some understanding of yoga, he may be may be able to give me some idea of, just work with the apanavayu. Or he might say, actually for this person the mind, and that's why I send them to you, so work with the mind, like that. So it is important. An integrated approach is absolutely essential, and it is high time that we have it. High time.
Actually, ma'am, and I also believe that yoga and Ayurveda should become a doctor's prescription as well. That in the doctor's prescription, they mention it that you need to do pranayama, you need to do yoga practices. And I was quite surprised that recently I have come across some of the doctors who are actually prescribing it like a medicine.
Yeah.
So for the mental health or for
Yeah.
the back health. So yes, but this change has to multiply. A lot of
Correct.
other doctors have to participate and make this platform as in where different signs are coming together and helping human being towards the wellness journey.
Yeah. Yeah.
So my next question to you is: have you worked with any patient, any individual who was in the advanced stage of cancer? When that person walked in your studio, your space, I'm sure that person was physically or mentally fatigued, in complete fatigue. So I want to understand what was your toolkit, immediate toolkit in that situation, in that scenario.
So, advanced, it need not be advanced stage, it could be any stage of treatment or recovery also when they have extreme fatigue. Sometimes there are situations when we have to go to their homes because they can't come. So, again, when you meet the person in the first few minutes, you will understand where they are, right? So you may not be making them sitting to talk a lot. You may just ask them to lie down. Sometimes I would say, let me just do some chanting for you and you just listen. And with the chanting, observing if their breath is settling down, maybe their body is visibly relaxing, their face is relaxing. Sometimes they doze off a little bit. Then we wait patiently and then say, okay, can we do a little bit of practice? Sometimes people say, no, I don't want to do anything. I just want to come and talk to you, or I just want to be here and go back. That's fine. But then sometimes we trick them into just doing a simple breathing practice or some simple arm movement or something like that. They already feel that the energy is picking up. Yeah, some lying arm movement, some just stretching the leg, bending with the breath. Slowly, they start warming up to the practice. And then once they have done some 15, 20 minutes of some practice, or just simply listening to the chanting, they feel better. They say, no, can I stand up and do something? So let's not just assume that they can't do anything, and but meet the person where they are. Sometimes it's just chanting and sending them off. Sometimes I have done worked with people in advanced stage where I might just say, okay, let's do some coloring. Or I had one student who said, I just want to paint my nails. I said, okay, we just sat and painted her nails, and she died like a few days later. So something that we can do. And once I invited her mother to come and sit with her, and her mother did the practice, and she did whatever she could. I and her mother did the practice for her. It was like a surrogate practice.
Wow.
So we chanted together, and she couldn't chant, but she was there, and she was absorbing that energy. So there is something that we can do, I feel.
Ma'am, this is very beautiful that how creatively you mention about the surrogate practice. A mother practicing on behalf of that person. But this is something which have come out from your experience and you have presented. How creative a yoga therapist has to be for that? Because usually a yoga therapist just follow the toolkits.
Yeah. So again, coming back to the way we are training in our tradition, this idea that meeting the person where they are, adapt the practice to the individual. If they can breathe, they can do yoga. This is something that is, it's like the mantra, that we follow. So um, sometimes we also land up doing very less when the person can do more. That's also the
Absolutely.
danger of this, right?
Yes.
They could probably do more, but we think, oh, this much is enough because this is how they are appearing to me and they don't have energy. The danger is always there. But as you train, and in training, there's a lot of work we do with observing other teachers teaching a class, assisting a class, and shadowing a teacher who's teaching a class with the patient over a long period of time. So all of that helps one to learn how to adapt. And different teachers have different orientations also. So I have some of my colleagues who love to chant, and chanting is their strength. Whereas I may be more tuned to working with the breath. Somebody else may be more with some kind of a meditative practice. Yeah, so each teacher or therapist will have also their personal orientation. And that might work because their Shraddha is so deeply imbued in that, right? So that's where the creativity comes, I think. And I have observed my teacher, Deskachar, every time he would work with a student, it will be different. Sometimes he pays a lot of attention to diet. Sometimes he will tell some story, and then he will just leave it there. Sometimes the story may just take,
Work
and the
there
person
and
may take
unconscious.
something in. Yeah. So there are a lot of different approaches. And I think the creativity is a very, very important part of the therapist's skill set, or what something somebody has to learn to develop.
Absolutely.
Yeah.
Yes. And I'm sure that comes with more of experience and keep going back to your teacher, what you said.
Absolutely. Absolutely. Yeah.
So, ma'am, my next question is that what is one of the biggest misconception or myth among common person, or let us say with the yoga instructors also, that how practicing yoga during a cancer treatment, like there is this kind of multiple myths, but what myth you would like to address that a lot of yoga therapists or common people have related to practicing yoga during cancer treatment?
And it's not just yoga therapists or doctors or patients, even people in the allied fields. What is the image one holds in the mind when they hear the word yoga? Okay, it's like the six blind men feeling an elephant and saying this is how the elephant is. Everyone has a different idea. Some people think yoga is all Surya Namaskar, or
Yes.
doing 1,008 Kapalabhati, or, you know, sitting in a contorted position, or sitting in Padmasana meditating for half an hour. They have all these ideas. So when you hear the word yoga, that is what they see. They don't understand what is that yoga about, right? So I think education and building awareness is very important. And so, once I was in a Ayurvedic center, and somebody came along and said, "Can you teach me some breathing, something simple?" And the Ayurveda, so I said, "Okay, check with the Ayurveda doctor," and they said, "No, you can't teach yoga." Then I sat with the Ayurveda doctor and I showed him a few things, and I said, "This is what we teach." He said, "Oh, that's all, just breathing and some simple movement. That's beautiful. Why don't you teach?" So he needed to understand that. Otherwise, he would, in his mind, it was Surya Namaskar. Of course, somebody with severe arthritis, I wouldn't be teaching them Surya Namaskar, right?
Absolutely.
So the misconception is people think yoga is about heavy duty practice.
So this misconception is actually getting strong. This conditioning is getting actually strong. The way we are portraying on different social media to capture
Correct.
that algorithm of attention.
Correct.
That's one. I'll say crime which we are doing as a yoga practitioners. That's not only there, but also now we have apps. I was recently having a conversation with one of the international student. She was telling me that how there are apps where you just have to mention the problem and you will get the yoga sequence and asana class. But this is something which we should stay away from, completely away from. And today's conversation with you, that how this is first is individualized, then second is how creative you have to be. So first understanding that human being, that individual, and then creating your own class as per that creative interest is something which artificial intelligence will not be able to guide you, just typing their disorders or disease what they have and
Yeah.
or what they have walk in. So I absolutely agree with you, and together as a team we have to fight with this conditioning also, but to whatever extent, I'll say let's keep doing the positive things and make it more stronger, strengthen our
Correct.
system
Yeah.
to lead that negative system which is happening in parallel.
Yeah.
So, ma'am, my next question is, since we are creating this kind of awareness for the cancer care through yoga therapy, I also want to understand that what are the red flags or the no go signs which you will explain or would like to share with us for a yoga therapist when they are working with cancer care patients?
So we would primarily look at how is the breath in the practice. So if the breath is compromised with the practice, physically somebody may try to push themselves. They may not talk about discomfort, and if the therapist is not uh, clued in, they may not be able to observe very keenly. You know, asking the right questions, seeing if the kind of practice is rightly adapted to the individual. But the breath is a clear sign that shows that something is going wrong. Now, to observe the breath is even more difficult than observing the body and the body cues, right? That's one thing I would say. But primarily, to not go with a set idea of this is what I will teach the student because they have filled the form, they have sent these are the symptoms, so I will go with this set of practice. That doesn't work. But really, a red flag, I don't know. If you have the right training and guidance, I don't think we can cause any harm to the student. It's not possible.
Absolutely. So when you talk about the right training, and I think one of my question to you today is also that what is the one skill or one attitude you expect a yoga therapist to have while working with people affected by cancer? Specifically, the skill should be beyond yogasana. So, what skill you expect them to have, or what attitude you expect them to have, but beyond yogasana knowledge?
So we have some understanding of the problem. We may also have some understanding of what the person is going through. Um, like I said in the beginning, self-awareness, building that and cultivating self-awareness is important. Um, The compassion that you bring into that space and being non judgmental. And we as human beings are judgmental by nature. So I might have given a practice to a student thinking this is going to work very well. They may come back and say, sorry, I didn't do your practice. It was boring for me. It was not interesting enough. I couldn't do it, whatever that might be. In that moment, I have to let go of all my ideas of what they should be doing
Right.
and simply accept where they are and work with it. So the ability to listen deeply, right? And when I listen deeply to the other, I'm also listening to what's coming up in my mind and learning how to put it aside and simply meet the person where they are. I think that's a very important skill to develop. And it's an attitude, it's something that one needs to cultivate and not assume anything, just take through questioning, through observation, just see what is that I can work with today. Like, I don't need a lot of information. I can just take two or three things that are important for today and work with it. So it's really to be fresh, coming in with a fresh mind, to observe, to listen, to hold a lot of non judgmental space for that person, to be compassionate. And if you ask me, do I know what is compassion truly? I don't know. But I'm learning what it is. And they will teach you because it's very hard for one human being to completely get into the shoes of the other human being, to even to understand what they're going through and to know that I don't understand. Okay, even if it's a very close friend or relative, we don't understand.
Absolutely.
That we need to know. Then we will be fully open, fully present. That presence is very important, I think. How to cultivate that presence with anybody for that matter.
Ma'am, since you're speaking about presence and compassion, I'm sure it reflects about the bond what a yoga teacher or a therapist share with that person, that individual. But here I have one more question. There are a lot of times a cancer patient do not want that kind of kindness, that kind of treatment, special treatment, I'll say, from their yoga therapist, because it a lot of time it happens that a yoga therapist or a yoga instructor gets into that kind of emotion. Oh, he's a cancer patient, I need to be
Yeah.
taking
So,
special care. But
yeah.
while sometimes that person want to feel like other students, does not want that special attention, then how to create that perfect balance?
So, exactly. This is where our own self awareness matters. No, what am I bringing into the space? If I am actually looking at that person with pity, that's not compassion, that's
Right.
pity, right? Like, I'm in a better place, they're not in a good place. I can do something. I have to rescue them. I have to fix them. If I'm coming with that attitude, it will reflect in the
Absolutely.
way they experience me. But if I can just come in as a companion, as a friend who can simply listen to them, and they can come and share their deepest fears about what's going on in their life. They're not just coming here for some treatment, they're coming here because they have somebody that they can talk to who will listen to them and who will offer some practice that will help them to take care of themselves better, that they are getting empowered, they're not dependent on. So the teacher's role is not to make the other person dependent on you. It's very important. And I think if we are able to hold that presence and self awareness, this will automatically happen. If we are coming in with our own baggage, invariably the other person will feel uncomfortable.
Absolutely. So many beautiful answers, so much of awareness today. We are so much like such an insightful conversation, ma'am. I'll say that there's so many lessons to take away. As a yoga teacher, yoga instructor, we need to work not only with the individual who's walking into a studio for a class, but we need to, in parallel, work on ourselves also, because there's always something which we are learning from that individual. And friends, today Saraswati ji has enlightened us on different parts of this yoga therapy. And if you want to learn more, we would like to invite you for our cancer teacher training course, which is starting from 22nd August. She's taking care of two modules. This is a 55 hours online live Zoom session delivered cancer teacher training course. We'll be more than happy. If you have any questions, please reach out to us. And thank you so much, ma'am, for joining us. It was wonderful and insightful conversation with you. It might change a lot of people to think how they are doing or hosting their class next time onwards. And once again, totally in
Thank you.
gratitude. Thank
Thank
you
you,
so much.
Shivani. Thank you for your beautiful questions.
Thank you so much, ma'am. All the questions were beautiful because we had such an insightful answers. Thank you so much, ma'am.
Thank you.
Bye.
Thank you.